Hi, I'm Dr. Aaron Glatt. I'm the chairman of the Department of Medicine and the chief of Infectious Diseases and Hospital Epidemiologist at South Nassau Community's Hospital. One of the biggest problems facing medicine today is the inappropriate and overuse of antibiotics. This is a problem that's shared by both patients and by their physicians. Patients feel that they need an antibiotic, and physicians frequently feel that they have to give in to that request from the patient. And in fact, sometimes antibiotics can be much more harmful than helpful. And many times an antibiotic is not only going to not help the patient, it can actually really hurt the patient. So what I want to do today is talk a little bit about some of the problems that we have with inappropriate antibiotic usage. An antibiotic is only going to be able to help certain infections, and only infections for which a bacteria is the cause of the infection, and the antibiotic is effective in eradicating, getting rid of that infection. That's a mouthful, I said a lot. What that basically means is that just because somebody has a fever or just because somebody has a problem, even though your friend got an antibiotic for it and you got an antibiotic for it the last time you went to the doctor, that antibiotic may not have been indicated, and that antibiotic may not be good for you. Antibiotics are a two-edged sword. They don't always help. They can hurt very badly. People can get fatal complications. One very well-known one is C. difficile, but there are many others, from allergic reactions that can be fatal to all sorts of complications, hurting your kidneys, hurting your liver. Antibiotics can be a great benefit if you need them, but if you don't need them, they actually are very dangerous and should not be used. How do you know if you need an antibiotic? That's what your physician went to medical school for, to help make that decision. Some of the most unnecessary usages of antibiotics are to treat the common cold. If a person has the flu or they have a virus, an antibiotic will not help them. If you actually have a bad case of flu, there are specific anti-flu medications that might be indicated. But if you have a runny nose and a sore throat, and you have the flu or a virus, and you're not that sick, you don't need anything that we can offer you in terms of treatment. We can try to make you feel better, but we don't have anything that will make that really get treated. Therefore, an antibiotic in that situation is actually dangerous and bad for you. Likewise, if you have what we call bronchitis, if you have what we call an upper respiratory tract infection, antibiotics aren't able to be treating that infection. And most of the time, an antibiotic in that situation, with some exceptions, is actually contraindicated. That means you shouldn't be taking it. When patients feel that they're going to a doctor and they don't want to be told, you have a virus, go home, sleep it off, you'll get better on your own. I just paid all this money to come to see the doctor. I want a prescription. Doctors are under the impression that they're helping the patient by giving them an antibiotic. That's not the case. It's actually dangerous. And physicians need to understand that prescribing incorrect antibiotics, because what can it hurt? It can actually hurt quite a bit. There's an education process going on right now in the country trying to eradicate inappropriate physician antibiotic usage. Recent studies have suggested that in some situations, for bronchitis, for example, 80 to 90% of the antibiotics being prescribed are inappropriate. This is a very important problem that both patients and physicians need to jointly help address. If you go to your doctor, ask them, why do I need this antibiotic if you get prescribed one? Is it really going to help me? And at the same time, if your doctor says, yes, you do need to take this antibiotic, so then you need to take it exactly the way the physician prescribes it, and not taking it when you feel like it or for a shorter period of time. This is Dr. Aaron Glatt. I hope you're healthy and stay healthy. Hopefully you don't need an antibiotic.